Hello, in this video we will discuss about the bradycardia and tachycardia mechanism as an introduction. So in this video we will just understand about the introduction of the bradycardia and tachycardia. So remember, the bradycardia mean the decrease of the heartbeat, while the tachycardia mean the increase of the heartbeat. So this is the person contain a heart, and this is the heart is the superior vena cava, and the inferior vena cava contain a deoxygenated blood toward the heart, while the descending aorta and aorta which that is carry the oxygenated blood toward the body, the systemic circulation. And this is the pulmonary vein and pulmonary artery. This pulmonary artery contain a deoxygenated blood toward the lungs, while the pulmonary vein contain oxygenated blood toward the heart. So this is the heart diagram, which that is the cross section. You can understand this is the superior vena cava and inferior vena cava, which that carry the deoxygenated blood toward the right atrium to the right ventricle through atrioventricular wall toward the pulmonary wall toward the lungs, deoxygenated blood through a pulmonary artery. And this is the right atrium and right ventricle. And this right pulmonary artery and left pulmonary artery contain deoxygenated blood. After the oxygenation through a respiration, the physical respiration, will lead to oxygenated blood move toward the pulmonary veins, toward the heart, to the left atrium, to the left ventricle through a atrioventricular wall or semilunar wall, and toward the aortic wall. So remember, this is the aorta, and after this, the when contract the heart, ventricle contraction will lead to eject the blood toward the body. So in this way, this is the ascending aorta and aortic arch. So here I am drawing the easy diagram to understand the bradycardia and tachycardia. So for example, this is the sinoatrial node and atrioventricular node. Sinoatrial node are present in the upper region of the right atrium, and the atrioventricular node are present between the atrium, both atrium. So after this, it will be fire due to the sympathetic and parasympathetic nerve fiber. If the sympathetic nerve fiber mean increase the heartbeat, so it will move like this for contraction. So the systolic blood pressure, which that will be occur due to the pacemaker. Pacemaker is known as the sinoatrial node. So that is here you can see the sinoatrial node, which that transmits the signal toward the left and right atrium. Ultimately the contraction of atria. So this is the activation of atria and contraction. So the activation of atria and contraction will be occur is systole, the atrial systole will increase the P wave. After this P wave in the ECG, which that is showing, and after this the sinoatrial node will transmit the signal to the atrioventricular node, and this transmits the signal and activation of the ventricle. After the ventricle activation, the contraction of the ventricle will lead to eject the blood. After the ejection, this is basically the Q or S wave will be increased, that is high due to the higher contraction for ejection of blood. So this is the, on the other hand, the recovery phase, which that is the T wave. This T wave is recovery wave, and in this way the diastole phase, diastolic blood pressure basically should be 80, while the millimeter of mercury, while the systolic blood pressure is 120 is normally. So here is the normal rhythm in ECG will that show in this diagram, easy to understand per minute beat, and you can understand their uh, difference. And this is the bradycardia, which that it decrease the heartbeat, while the tachycardia which show the in the ECG diagram the wave will be increase more contraction and relaxation. So this is the waves which that increase. So the tachycardia is, let's begin to understand the heart rate over 100 beats per minute. And many types of irregular heart rhythms, arrhythmias will be occur. And this basically can cause the tachycardia. A fast heart rate isn't always concern, And increase the sympathetic nervous system means increase the heartbeat, means the increase of the blood flow toward the body for alertness. So remember, and in this way, when sympathetic nervous system increase, what is the stimuli for the increase of the sympathetic nervous system? So this is the brain, which that is stimulation through anxiety, depression, fear and alertness, and fight or flight mode, and fever or other things. Basically, which that will lead to stimulate the brain with a specific area, the higher brain cortex, which that will lead to stimulate the sympathetic nerves fiber. This is the sympathetic nervous system activation will target to the heart and blood vessel. So when target to the heart, it means it will it will stimulate through neurotransmitter via a sinoatrial node for firing. And in this way, the output of the heart will be increased while the input will be decreased. That means it will increase the heart rate, mean increase the blood pressure. And hyperthyroidism, which that is the problem which that also lead to increase the tachycardia. And the water dehydration will lead to the amount of blood circulating through your body decreases. Your heart will try to compensate by beating fast and output increase. On the other hand, here is the endocrine system. In this way, the adrenergic neuron during the sympathetic nervous system will activate the adrenal gland, which that adrenal gland produce the catecholamine. This catecholamine will also target to the heart and blood vessel for the vasoconstriction due to cortisol and release, and epinephrine also release. And in this way, it will target to the vasoconstriction and vasodilation in the digestive system. So what that means? That means increase of the vasodilation in the digestive system, while the increase of the vasoconstriction in the blood vessel will lead to increase the blood pressure. And the response of the hypotension is basically also trigger the sympathetic nervous system. Anyhow, this is the blood vessel which that is constriction after the action of the sympathetic nervous system. And on the other hand, the immune system, mast cell, when allergic reaction, the anaphylaxis, which that will lead to vasodilation first by the binding of the antigen, the allergen, for degranulation of the mast cell, which that will release the histamine, and histamine will target to the blood vessel for the more permeability but the more vasodilation. And after this vasodilation will the stretch receptor or baroreceptor, so the mechanoreceptor, which that is detect and lead to increase the sympathetic nervous system by the compensatory mechanism. While the smoking and coffee and exercise, three main things can be stimulate the vasoconstriction will lead to increase the tachycardia. Due to the constriction and high blood pressure means the blood flow will be increased. So that when blood flow will increase means the heartbeat will be faster. So the bradycardia is basically the different term which that is the opposite totally. While here is the basically the dehydration of water is basically the amount of blood circulating through your body decreases, your heart will try to compensate due to the volume will be increased, and the blood vessel will lead to constrict the blood vessel by beating fast, output increase due to the constriction of the blood vessel. But initially the bradycardia will be occur when dehydration. That is why the low blood pressure, but the drastically increase due to the sympathetic nervous system innervation. So on the other hand, the inflammatory stimuli will stimulate the cells to release the tumor necrotic factor alpha, interferon gamma, and interleukin 2, which that will target to the local tissue, and inflammation and ischemia and tissue damage will be occur. This tissue injury, which that means the hypoxia. Hypoxia means the decrease of the oxygen will lead to change the biochemistry of the cell. So the AMP will convert into the adenosine through a AK, adenosine monophosphate kinase, while the SHA hydrolase, which that convert the SHA into the adenosine also, and this adenosine will convert through adenosine deaminase enzyme to convert the inosine, and this adenosine basically go through a adenosine transporter channel, move out into the adenosine, and this will target to the heart cell, the A1A receptor, adenosine 1 receptor, A receptor. In this way will lead to bradycardia. So on the other hand, here is the heart, which that is also the mast cell produce the nitric oxide, will target to the blood vessel for vasodilation. So remember, this vasodilation will lead to hypotension, and this is the hypothyroidism also involved, and this will lead to cardiac pacemaker cell will target, and to decrease the blood pressure due to the vasodilation. And after this vasodilation, the hypothyroidism also involved, and the bradycardia is basically occur. This bradycardia means the decreasing of the heartbeat due to the more volume of the more vasodilation, and this vasodilation will lead to decrease of the heartbeat. So sensation of the bradycardia, which that will stimulation will of the mechanoreceptor to again trigger the sympathetic nervous system, and after the sympathetic nervous system, that heartbeat again will be maintained through tachycardia. So this normally function in our body during the exercise, the tachycardia will be increased, while the bradycardia during the rest time. So this is the basically is the bradycardia and tachycardia mechanism and introduction. So thanks for watching. Bye.